Hi, Paul Griffin here, MARTA's Director of Infectious Diseases, with an update on COVID-19. We continue to see a lot of COVID-19 news in this country, and while broadly we've got excellent control, we do still have a situation in Victoria that, while trending in the right direction, is very significant. We also have seen some transmission in New South Wales, and given how close it is to Queensland and how much people are still travelling, it's a good reminder for all of us that COVID-19 remains a risk. We've also seen the situation unfortunately head in the wrong direction in New Zealand, which again should be a really important reminder for all of us here in Queensland, both metropolitan and regional, that COVID hasn't gone away and can easily be introduced into a population. And so I'd like to thank everyone for all the hard work they've done so far. I'd like to remind everyone that it's not over and we need to keep up this hard work, and that particularly is hand hygiene, social distancing and getting tested if you have any symptoms potentially compatible with COVID-19, and staying home in isolation until you get that result. Given our excellent control, it's great that people can go out and about again, can go and get coffee, do their shopping freely and even dine out. But it's really important to remember, while these activities are permissible, it doesn't mean COVID-19's gone away. And to do those things safely will mean we can keep in the situation where we can do those things and not need restrictions. And what that looks like is when you're out shopping, getting a coffee, eating out, catching up with friends, make sure first of all that you don't do any of those things if you have symptoms and you get tested, and stay home till you get the result. And if you are out and about and potentially interacting with other people, stay that 1.5 metres apart and keep up your hand hygiene at all times. COVID-19 can easily come back, and if we don't do these things, the impact of a small reintroduction of COVID into a community, even if it's a regional area, will result in a really large outbreak. So these measures are vitally important. The ready access to effective testing has been a huge part of our success in this country and continues to be one of the main tools that we will need to stay on top of COVID-19. And what that means is if you have any symptoms at all, and the main ones particularly are a fever, a sore throat, a cough, but basically anything out of the normal that's concerning, see your doctor to get a test or go to a testing clinic to get a test, and stay home until you get those results. Making sure we don't miss any cases by testing every possible case will be a really big part of staying on top of COVID-19 moving forward. There's a lot of discussion lately about vaccines, and it's no wonder, because a vaccine is really going to be the tool that we need to get back to normal or near normal. The vaccine research that we're seeing has progressed faster than ever before, and it's really exciting, with some very promising candidates in the late stages of clinical trials. There's also been some misinformation about candidates that are already in use, for example, but I can reassure people that the testing on the most reputable lead candidates is going really well, and we won't recommend a vaccine that hasn't been through all the stages of testing required for us to be confident that it's both safe and effective. And we're getting near that point actually. The clinical trials are in their final stages, so hopefully sometime next year, it's hard to know exactly when, we'll have a vaccine available at least for some of the population, the most vulnerable or those at the highest risk. And that will be a really big part of helping us get back to near normal. I'd like to wrap up with a big thank you. While our health systems and our restrictions have had a really big part to play in controlling COVID-19 in this country, it's really been the individuals in the community that have all played their part that account for our success. And if we keep doing that, even if we have some small breaches from time to time, we'll keep the situation under control, keep our day-to-day lives as close to normal as possible with those restrictions. And so again, thank you to everyone for keeping us in such a good position.